Hi there, you're welcome to Demi RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on YouTube, as well as be able to support our community here at Demi RX Care. So what is our topic of choice today? Our topic today is going to be a medication called Invokana. So Invokana is also known as Canagliglozin, which is the generic name of the medication. So this medication is used in our patients with diabetes in order to help manage their diabetes, in addition to other lifestyle changes such as diet as well as exercise that these patients are doing in order to help control the diabetes condition. So this medication works by reducing amount of glucose that's being reabsorbed back into the blood, and by doing this it can kind of help with lowering the blood glucose levels. So this medication is usually taken as 100 to 300 milligram by mouth daily. So patients are either on the 100 milligram tablet or they're on the 300 milligram tablet, and they take one tablet a day. So like I said, the medication comes in 100 milligram as well as a 300 milligram tablet. So what are some of the side effects that you want to look out for when you're taking this medication? This medication can commonly cause yeast infection in patients, most especially our female patients. It can also cause urinary tract infection. It can cause increased urination. Like I said, patients are consistently going to the bathroom just to urinate in order for their kidney to be able to filter out those blood glucose. Patients might have increased thirst. As you probably know, the more you pee, the more you feel dehydrated, and you want to, drink plenty of fluids to kind of replenish your body from those liquids that you're passing out. Also, this medication can cause low blood glucose, which is kind of one of the reasons why we're using the medication to reduce the blood glucose, but just an abnormal level of the blood glucose reduction is what we don't want. All right, so this medication can also cause low blood pressure as well. So what are some of the serious side effects that you want to reach out to your doctor immediately for? So this medication can cause increased cholesterol, and we already have most of our patients on diabetes medication taking a medication called statin, which is used to help control their blood cholesterol. So this medication, where this serious side effect might not really be prone in those patients that are already on the statin drug, but it's just something to be aware of. If the statin drug is not able to control that, then we might want to switch the patient to another medication for their diabetes to see how well that works. All right, this medication can also cause increased risk of fractures. It can also cause an increased risk of bladder cancer. So in patients who have a history of bladder cancer, this is not a favorable medication because it can increase or worsening that disease in these patients. Also, this medication can cause a condition called Fournier's gangrene. And what this does is patients start having a scrotum pain or redness, or a penis pain or redness while taking this medication. If you start feeling that, then you want to make sure that you reach out to your doctor immediately regarding this. That way they can monitor you and make sure they're switching over that medication or substituting it for another medication that will have the same effect, which is lowering your blood glucose without that serious side effect. All right, so this medication can also cause kidney injury. So it is contraindicated, which means we don't take it if the patient has a end-stage renal disease or the patient has a kidney failure. It can also cause an increased risk for leg or foot amputation. So in patients who already have a history of amputation, this is not a medication of choice because of that increased risk that it can cause. Also in patients who have a nerve condition or patients who have a diabetic foot ulcer, or we want to make sure that we're avoiding that medication in this patient population. So what are some other things that you want to know about this medication? So this medication is preferably taken with the first morning meal of the day. So like I said, it can cause increased urination. So you want to make sure you're taking it earlier in the day. That way you're not waking up at different times of the night to urinate. Also, this medication can cause dehydration, so you want to make sure that you're drinking plenty of fluids in order to be stable when it comes to your electrolytes, because as you're losing those electrolytes, you want to make sure that you're replenishing them. That way it doesn't cause another side effect because you're having lower levels of the minerals that your body needs. All right, so this medication, also with while you're on this medication, we want you to go for your quarterly A1C. That way your doctor is able to monitor how well the medication is working, and kind of see if they want you to stay on that medication or switch over to another medication that might help in controlling the diabetes. All right, so this medication also has an added effect, which it can help reduce the risk of something they call the cardiovascular mortality, which in patients, as you probably know, in our patients who have diabetes, some patients might have high blood pressure or high cholesterol, which isn't really good for the heart. So this medication has an added benefit of reducing, heart-related disease or death in patients who have diabetes. So I hope I was able to help you in terms of what to look out for while you're taking this medication. For more information, you can comment down below regarding your concerns, and we'll try to get some answers for you as soon as we can. Or you can check out our website and consult with a pharmacist at www.demiarxcare.com, and you'll be able to consult there with a pharmacist.